Again, it mirrors what you have up at your office. We have 9 mills. We've got 3 3D printers. We've got full-time lab staff.
No kidding.
We'll place implants one day. We'll deliver the prototypes the next day.
Yeah. Nice.
Much like you were talking about today, get our occlusion balanced out just like we want it, and deliver the either PMMA or zirconia finals. And it's really life-changing for so many people.
Welcome back to the All In, All On X podcast, where we take you behind the scenes of full arch dentistry, innovation, and the people who are redefining what's possible. Here we go beyond the procedures and into the lives of people shaping full arch dentistry. This isn't just about implants or workflows. It's about the lives we build, the decisions we make under pressure, and the leaders who push this profession forward when no one's watching. Get your head straight, because we're about to go all in. The All In, All On X pod is brought to you by JB Dental Labs, the elite lab trusted by full arch surgeons, prosthodontists, and digital forward practices internationally. JB specializes in precision full arch restorations, zirconia, PMMA, photogrammetry workflows, and fast turnaround times that don't sacrifice quality. JB delivers a truly digital workflow powered by their proprietary online portal for easy case uploads, real-time tracking, and fast, streamlined communication. If you're looking for a lab that understands immediate load, passive fit, and the demands of modern all-on-X dentistry, learn more at jbdentallab.com. Tell them that the All-In, All-on-X pod sent you.
You've heard a couple?
Yeah, I've heard a couple of them, yeah.
I would have said the same thing.
Yeah.
Okay, let's kick it off.
All right, my friend.
All right, welcome back to the All In, All On X podcast. I'm your host, Adam Hogan. I'm sitting here with a good buddy of mine for the last 20 few years, Walter Chitwood, Dr. Walter Chitwood. Welcome to the program.
Hey, thanks, man. Appreciate you having me on this afternoon.
I've been excited about it. So I'll give you all a little background for you guys listening at home. We are in person today, which is always a special treat. We're in Washington, D.C. at the Alabama Implant Study Group meeting here, annual meeting, and where I had an opportunity to speak, which was a true honor. But this is a truly historic club. All right, we're going to get into that. But before we do, tell the audience a little bit about yourself, where you're from and how long you've been practicing, et cetera.
Well, I've been around the block quite a bit. I'm from the Middle Tennessee area. Live in Murfreesboro, practiced there for 38 years. Graduated in 82 from the University of Tennessee, went back to Murfreesboro where I went to college to practice. Practiced there till about 6 years ago, sold my practice, and then have had the opportunity to practice in Cookeville at pretty much my practice that I'm working at now closely mirrors what your practice is, Adam. All the protocols that you described today is exactly what we do in our practice.
That's perfect.
And it is just, we work for Dr. Johnny Shanks at Golden Oak Sedation Center and Implant place, and it's just absolutely wonderful. Also, I teach at Lincoln Memorial College of Dental Medicine up in Knoxville. So I'm doing a lot of driving these days, but having a good time. It's about, takes me about 2.5 hours to get there from my home. And then I do that on Tuesdays and drive back to Cookeville, and I practice there Wednesdays and Thursdays, then I go home.
Okay.
So yeah, having a good time.
We got a lot to talk about. So you've been at this since 82, and, do the math for me. I mean, how many years?
Oh, man. Now you're asking me to decipher. That's why I went into dentistry. I only had to know 1 through 32.
44 years?
44 years, yeah.
Dang, wow. Yeah. So you've been at 44 years. You had a practice sale 6 years ago, new practice, a lot to talk about in there. Big history in the AAID, Alabama Implant Study Group. My God, let's kick it off right there. Tell me about this organization, which might be the oldest implant organization in the world, or is it?
It is the oldest implant, I won't say organization, but study club.
Right.
if I'm thinking correctly, it started around 1970 and has been here ever since then. Started out as a study club, and then they started educating people. They used to have what was called the Alabama Implant Study Group Dental Congress in Birmingham every year.
Okay.
Now, this was back in the mid 80s, and there were very few implant meetings where you could go and learn. Now there's 15 every weekend all over the place, but then there were 2 or 3 internationally. And the largest one probably in the whole United States was in Birmingham, Alabama every year. And there would be between 800 and 1,000 docs there.
Yeah.
From all over the world. It was amazing.
Everywhere, not just Southerners. Northern Yanks.
Oh, everybody.
International.
And international. I remember Manuel Chandevez from France was there. We had folks coming from all over the world. It was amazing.
Why was it Alabama? Why was that the epicenter of implant dentistry?
Well, you had some of the pioneers there. Hilt Tatum was very involved with it. But you just had guys who were of like mind. Okay, Ford Turner. We used to place a lot of implants in his office. That was part of the training program that they had. And Bobby Lewis, who was an oral surgeon, was there. There were Bill Belandi. I mean, there's a lot of older guys, Walt Canals, Crawford Tatum. I could go on and go on with all kinds of folks.
Right.
But when I first started, it was kind of funny because it was the transition of where dentists started wearing gloves. And I remember Ford Turner in his office the first day wore no gloves. A lot of pushback about that.
Okay.
So the next day he came in and he was wearing one glove. And he said, well, I'm wearing one glove to satisfy some. I don't have any gloves on the other hand. He said, I just hope I make everybody here happy. And it was hilarious. But it's, throughout the years, back then the training was entirely different than what we have now. Back then we had lots of different modalities. You have all these modalities on the wall. What kind of bone were you presented with? Well, you would pluck the appropriate modality out and apply it to the case.
Okay.
Nowadays, we grow bone.
Right.
We've got all of these different procedures that we're able to totally restore folks without having to go to the extent of surgeries that we used to have to back when we were doing subperiosteals.
Right. So
that was interesting.
I'll bet it was. Flapping, taking an analog impression, bloody field, making sure you don't get your impression material wrapped around a mental nerve.
That would make a long day right there.
Yeah. And then trying to hurry up and get that poured and get something cast. And how much time would it take to cast?
Well, we had, everyone at that point that I knew of that were doing subs, Root Lab was doing it. And you could do it in 48 hours.
Yeah. They'd fly it down and pick it up.
Out. They would be waiting at the airport for it. And then you would have somebody on your end waiting at the airport for it.
Yeah.
And I never did that. I did a 1 month turnaround. But it took a while to get everything done. Some of the subs, well, I will say this categorically speaking, all the subs that I placed lasted a lifetime.
Great. Yeah, absolutely.
We placed them in the mid 80s. 40 years later, most of the patients, all the patients that I know of have passed. So those implants lasted a lifetime.
Absolutely. That's truly amazing. And I believe you because I've seen tremendous success on subperiosteals in my practice. I still do a few a year, 2 or 3 or 4 or 5, maybe tops, but I still do a few. I see great success. Mine are 20 years old now. I'm carrying after some of Truman's that are 30 years and more. So I believe it. What goes into a long-lasting subperiosteal implant? I mean, just a few basics.
Well, the big thing is treatment planning. The second thing is there was a saying that I believe you said today, something about bone, but tissue is the issue.
Well, yeah.
And the closure around subperiosteals was always the key component.
Right.
And then, of course, with anything in implant dentistry, proper prosthetics is absolutely the key long term. There's no doubt.
You like that that flat line occlusion that I talked about today? Do you guys, are you a proponent of that? Or?
We've been doing that ever since subperiosteals. As you may recall, Root had a thing called cutter bar teeth.
Yes, we have those.
And those absolutely don't get any more flat plane than that. It's just a bar that's flat. And absolutely, I have practiced a reduced level, and I've always called it a reduced occlusal level my whole life.
Little closed vertical.
Yes. And it's just absolutely wonderful. And I think that's the key to the success long term.
Hey, if today's conversation is pushing you to think differently about full arch dentistry, that's exactly why we built the Atlantic Implant Institute. This isn't just a weekend course or a set of disconnected modules. The core continuum is a purpose-built curriculum. It's designed to develop full arch surgeons and prosthodontists, not just expose you to a little content. From boot camp fundamentals to advanced prosthetics and digital workflow to remote anchorage and FP1 philosophy as well, we teach you structure, judgment, predictability, didactic, hands-on, type it out, live patient cadavers. Plus, we teach business thinking required to make it all work in real practice. There's nothing like it anywhere in the country because this was not built to be common. Learn more at theatlanticImplantInstitute.com.
If you're going to err on the side of vertical for your occlusion, for God's sakes, don't let it be too open.
Don't let them
crash it down on it. I mean, we don't want to have an error, but let's give a forgiving error if we're going to have an error, right?
Exactly.
Yeah. I believe I'm a little remiss to not mention that in my presentation this morning.
Well, you were dead on the way that you explained condylar centric.
Okay, thank you.
To me, that's all about the case. One of my dearest friends specialized in TMD and joint treatment, and all he harped on his whole life was condylar position.
Yeah.
And Cliff Simmons. Matter of fact, I thought so much of Cliff that when I was the program chairman for this very implant study group, we met in Charleston. He was our speaker.
Perfect. Yeah.
2 days he spoke to us.
2 days.
Spoke to us 2 days about that. Also trigger point injections. There was a lot of things that he shared with us.
What year was this?
Oh my, now you're asking me. With white hair, I forget a lot.
Yeah.
I would say that was probably 20 years ago.
Yeah.
Something like that.
Which goes to reinforce my point all the time is that there's very seldom new novel ideas out there. I mean, there's been a lot of smart men before us coming generations ago, probably wrote it on the back of napkins for 1930, for God's sakes, but they wrote it down, somewhere.
Yeah.
And things just keep on surfacing. And, I always say, I never claim to invent anything, but as far as condylar centric goes, I don't see anybody else talking about it in the full arch world in 2020, 2026.
No.
Like it's forgotten.
Well, so many people are, I don't know, a lot of these full arch places don't have the training. And you touched on this today. There's a lot of train wrecks that occur all over the country.
Right.
And for someone who dabbles in full arch things, to me, that's dangerous. That's absolutely dangerous. And it's like anything in life. I've got friends who have gotten themselves dabbling in orthodontics. And I had a dear friend of mine that said, if you want to do ortho, go through an ortho residency.
Go on,
If someone wants to delve into full arch restorations like you and I do, get the proper training.
Yeah.
Your institute is just, incredible with that.
Thank you.
And that's just good, solid, fundamental, proper training. And it keeps people out of trouble.
Yeah.
Complications, don't arise near as much. We all have, I don't care how good you are, you're going to have complications. But
Yeah.
if you're trained properly, those are minimized. And
Yeah.
you do a very good job with that up there at your institute, no doubt.
Well, thank you. And, just we're all, like you said, we're all going to have complications. I showed you a couple things today that weren't ideal, but we know how to deal with it. We know how to pivot. We know how to manage it. And that's kind of the difference, right?
Yes.
You're in a full arch treatment center now. Explain that to me. 6 years now you've been here at the new practice?
Yeah.
Is that right?
I have been. Well, let me give you a little history about this.
Okay.
When I sold my practice, I practiced with a gentleman I sold it to for a year. He did not renew my contract after that year, so I was removed from the practice, so to speak. And for the first time in my life, I was unemployed. And one of my good referral doctors that practices in Cookeville, which was outside of my covenant agreement mileage, called me up and said, "Hey, why don't you come up here and teach me, practice with me?"
Guy.
So I went and I practiced with Dr. Gerald Bryant.
Yeah.
And Gerald is a wonderful man, outstanding dentist, and practiced with him for 4 years. And then I got a phone call, and I live in Murfreesboro, Tennessee, which is like 90 miles away from Cookeville.
Okay.
So I get a phone call, and it was from Jacksonville University, where our the only residency program in comprehensive oral implantology, that's the residency. There's only one. And they called me up, and it's kind of a hybrid program. All the didactic stuff is done online, but all the clinical training is done in different clinical sites across the country.
Right.
Okay.
Right.
So they called me up and said, there is a new clinic that's going to open, and we're thinking about opening up a site there.
Okay.
Would you be interested in being the clinical director for our residents? And I said, sure, talk to me about that. So we discussed it. It sounded absolutely wonderful. And they said, there's only one catch. And I said, well, what's that? Said, it's in a little smaller town called Cookeville, Tennessee. Have you ever heard of it? And I laughed for about 5 minutes. And then when I regained my composure, I said, I've been practicing in Cookeville for 4 years. So I have an apartment there. I used to come out, turn left, and go drive 5 minutes to work. Now I turn right and drive 5 minutes to Dr. Johnny Shank's office.
Yeah.
And it is absolutely magnificent.
Wow.
Again, it mirrors what you have up at your office. We have 9 meals. We've got 3 3D printers. We've got full-time lab staff.
No kidding.
We'll place implants one day. We'll deliver the prototypes the next day.
Yeah. Nice.
Much like you were talking about today, get our occlusion balanced out just like we want it, and then deliver the either PMMA or zirconia finals. And it's really life-changing for so many people.
The All In, All NX pod is brought to you by JB Dental Labs, the elite lab trusted by full arch surgeons, prosthodontists, and digital forward practices internationally. JB specializes in precision full arch restorations, zirconia, PMMA, photogrammetry workflows, and fast turnaround times that don't sacrifice quality. JB delivers a truly digital workflow powered by their proprietary online portal for easy case uploads, real-time tracking, and fast, streamlined communication. If you're looking for a lab that understands immediate load, passive fit, and the demands of modern all-on-X dentistry, learn more at jbdentallab.com. Tell them that the All-In, All-on-X pod sent you.
That's awesome. So you do it the same way. So, I kind of talked about today, same day delivery. If you got anything wrong at all, fix it tomorrow. So I didn't say this today, but in my practice, it's like we got an hour and 24 to make great set of teeth, and I got 24 hours to fix it. That sticks with the team. So if anything's off, even if it needs to be 5% better, or God forbid 50, but it's better tomorrow. It's always good tomorrow. The occlusion, always perfect.
Well, in these days we can do so much with our facial scannings. All the algorithms marry all of our fiduciaries, like you described today so perfectly. I can't recall the last time we had a 50 in our office. You know, usually it's
No,
just a touch here,
yeah.
touch there.
Yeah.
But yeah, it's we don't. Yeah, it's amazing. It is absolutely
For
amazing.
those of you listening, 50's never happened in my office either, but let's just say that your fiducial marker just vanished and all of your preoperative records vanished. We could still get there tomorrow if we had nothing at all.
Well,
Yeah.
those of us who've been around the block, folks who have been trained with nothing but the latest technology are kind of hung up.
Wait. You're saying you didn't have a computer in the office in 1982?
We didn't have CAT scans in 1982.
Yeah.
You know, we were just, you know, us old analog guys, we can make the world still go around.
Yeah.
You know?
We'll figure it out.
Yeah. And sometimes you will look at things and you go, oh, I need to reach back in my memory. And I've seen this before. Now, it's been 30 years, but I've seen this before, and it's not a big deal.
Yeah.
And you're like me. You'll get a phone call from a colleague who's been in the field for 10 years, and they haven't seen it.
Right.
And they don't know the answer.
Right.
But they'll call us up and they go, hey, I've got this. I said, this is going on right now. What do I do?
Patient's in the chair.
Patient's in the chair.
Yeah.
And you tell them and they go, oh, why didn't I think of that? And it's because, well, you're in the middle of it and your thought process isn't unencumbered like ours is right
That's
now.
right.
So, yeah. So it all works out great.
Yeah.
But that's kind of where I am right now in my practice lifetime. I keep telling folks I don't know much, but what little I do know, I don't want to carry to the grave with me.
No.
And, you know, we've lost some of our gurus in the past few years. Hilt Tatum I was in his very first educational continuum down in Clearwater, Florida.
What year?
This was 83.
And how did you came out in 82. So how did you manage to get into 83 class?
Okay. So here's the way this went. When I was in dental school, through a turn of events, and it's a long story, but I was able to get a lot of hospital dentistry training.
So we back up for the listeners. Hilt was very selective. Was he not?
He was.
That's why I say, how'd you manage to get in? Go ahead.
Well, I was at a Tennessee AGD meeting. Okay. And it was a huge meeting. There's probably 500 or 600 doctors there. And I'm watching Hilt Tatum crestally elevate sinuses and place these large S implants that he had. And half the crowd was going, that's crazy. And they walked out and I was fascinated. Well, I'm a young pup. I don't know any better. I go up to Hilt in the hallway. Dr. Tatum, yes, I'm Walter Chitwood. You have had the most amazing presentation that I've seen in forever. I want to do what you're doing. Where do I go to learn that? And there were no institutes around at that point. Everything was over the shoulder. A lot of people would go to Linkow's office and watch him over the shoulder. Everything was over the shoulder. He said, I am opening up a new institute. He said, here's the information. Why don't you call Monday and see if you can get in? So I called up Monday. A lady named Charlene was there. Sweet lady. She sent me information and I had to fill out all of these forms about surgical experience and things like that. I did not outright lie, but I did embellish a bit.
Nice adverbs.
Yeah. So fast forward, the program then, we would go down every month and it was 20 months long. Now, he was kind of winging it too because he had been teaching, but not in a situation like this. So we would go down and at about month 10, we were just chatting. And that was, if you ever knew Hilt Tatum, he was just an open, honest, very approachable, down-to-earth guy, or at least he was to me and everybody I've ever talked to. And he was a consummate educator.
Yeah.
And he goes, when did you graduate from dental school? Just small talk. And I said, well, 82. His head snapped around and he goes, really? He said, you don't operate like a guy that's a fresh graduate. And then he pointed his finger at me and said, had I known that, you'd have never gotten the program. And I said, well, brother, I'm halfway through it now. I guess you're stuck with me. And we had been dear friends for, the rest of his life.
Yeah.
And it was just a lot of fun. So that's how I got involved in implant dentistry, finished his program. And then I was at a business management program with a doctor named Ken Keller. And Ken was friends. There was an old management program called Quest. And there was, in part of the Quest training, there was a guy teaching people how to do implants. And this guy showed up at one of Ken's places, and he walks in and he said, hello, my name's Carl Misch. And he said, I've opened a new institute in Dearborn, Michigan. And I'm going, oh. And I was the only implant guy in that management meeting, okay? So we were in Atlanta. Carl had a booth at the Alabama Implant Study meeting that was going on. The conference was going on in Birmingham.
Yeah.
And he said, we've got a few spots left in the upcoming class. If you'd like to learn about implant dentistry, please come. And he walked out. When that meeting was over on Saturday, I got in my car. I drove from Atlanta to Birmingham, went up to his booth and signed up for his course. At that time, Carl was running 3 classes a year. I was in his 10th class, so I was kind of on the front end of his training. And Carl at the time taught all the different modalities. Hilt had taught us blades and root forms and Ramus frames. Now, Hilt, we did not use any spade drills. Everything that we learned from him was with osteotomes. Okay.
Right.
So when I was going through Carl's training, Nisnik had just come out with the Corvent implant.
Okay.
So we all bought Corvent kits.
Yep.
And we placed them in his training program, the old Corvent hollow baskets.
Yeah.
So
I ran across some of these 2 weeks ago. Go ahead.
Yeah.
Yeah.
The abutments were not threaded. They were cemented in.
Yep.
And it was just a wonderful education. So very quickly, I went through 2 of in my opinion, some of the biggest gurus around, getting their training. And I hadn't been out of school 5 years. And so pretty soon, it kind of took over my practice a few years later.
Yeah. For those of you guys listening at home, especially you youngins out there, you gotta look up Hilt, and you gotta really look at everything he did and everything he stood for at the Academy. And Lenny Linkow and some of the others, Carl Misch, obviously you all know. But so much comes out of that. So I think osteotomes, when I went to work for Truman,
Yes.
he was big. We were big on osteotomes. He said, you're going to learn how to spread a ridge. You're going to learn how to lift a sinus. We did all that. I mean, right from the get-go. What an invaluable experience, because otherwise I would have never learned really what bone felt like. I mean, if I was to get out of school, since like Versa came out, right? And so it's been probably 13, 14 years for that, I think. If you got out of school in the last 14 years, you were just handed this drill and say, well, just turn it in reverse at 750 RPMs and pump it a little bit. But you don't have that feel in a handpiece.
No.
I don't think I would have learned really half as much about bone, if I didn't have osteotomes in my hand. I still have Hilt's old cassettes, and you know how much they weigh.
Oh, yeah.
Every one of them is like 25 pounds. What a great experience to have.
And I can remember, speaking of when you first started, I can remember we're at an Alabama meeting, and Truman Baxter said, well, I'm about to slow down a little bit. And I said, really? What you going to do with your practice? I got this young whippersnapper. He's been in the Navy. And, and he went on and on about you. And I remember meeting you I think it was at the next AAID meeting. Both of you were there together, and that's when I was introduced to you.
Yeah.
And, the rest is history. And I was so glad today, Adam showed pictures of him and Truman together somewhere.
Yeah.
And I'm glad to see that he's still around. He's still doing well.
Yeah.
Because I haven't talked to him in decades.
Oh,
It's
man.
been forever since I've talked to him. So I'm glad to hear that he's still, doing okay.
Well, if you pick up the phone and give him a call, he's still as ornery as I'll get out. And he reminisces about those days, the days he remembers best, 70s, 80s, 90s, all of his good friends, just like it was yesterday. So you should pick up the phone and give him a call. I love that guy. Like, he's like another father to me.
Oh, I can imagine.
But you can imagine Truman, when I started out with him, it was hard for him to let go. He's just like it's hard for me. I'm trying to do the same thing right now. I'm trying to bring someone in. It's hard for me to let go. Sometimes I got to watch my associate, even though he's a prosthodontist. James might be listening, but you watch him and you're like, okay, I'm just going to let you'll do it a different way. I'll let you do it. Go ahead. It's hard.
Well,
let somebody do that in your practice.
I can appreciate that so much. The hardest thing ever in my professional career was not being the boss. And when you no longer have to worry about payroll, you don't have to worry about employees, you don't have to worry about if the roof leaks.
Mm-hmm.
That seriously took a toll on me mentally for a bit.
Yeah.
And now I wouldn't have it any other way. But that will be a challenge. I'm just telling you, that will be a challenge.
I don't know. You said that you sold your practice and a year later, you didn't get your contract renewed. And, my wife and I, we joke about that all the time. Like, we'd love to not get hired back, maybe. You ever been in the middle of a 4-hour surgery and have somebody knock on the door? It can't wait. The toilet's leaking. What should we do?
No,
yeah. Like,
yeah.
What do you know?
Oh, it just, literally, we were at our office and, Dr. Shanks has built this Taj Mahal. It's amazing. And, we've got 3 surgery suites. We've got 22 operatories, and it's a few years old.
Good Lord.
We were there one day, and I've always joked there with him. I go, gosh, and the roof was leaking.
Mm-hmm.
And I was looking up at it. It was late in the afternoon, and I'm looking up at it, and I go, dang, son, that sucks no matter how you slice it. Okay. Let me know when you get it fixed. I'll see you later.
Yeah. I look up and go, man, somebody should do something about that.
That's not good. Yeah.
I've been in the middle of the building, and all of a sudden a thunderstorm, and the skylight just starts pouring, like it just gave way. Ownership problems, right? But I wouldn't have it any other way.
Well, I've always told folks, I said, you never really enjoy life unless you're the captain of the ship, to be honest with you, in my opinion. Now, sometimes it is an ocean liner, and sometimes it's a canoe.
Right.
The size of the ship really doesn't matter, but there's just a special feeling when you are in charge of something like that, and especially folks who are wired like you and I.
Mm-hmm.
And then, it's like everything else. I painted a house one time, done that. Don't need to do it again.
No, sir.
I don't need to own a practice again.
Mm-hmm.
There are just too many educational opportunities around.
Mm-hmm.
And it's really, I will be in debt forever to Gerald Bryant and to John Shanks, who allow me to show up, love on people, and that's my job, is to show up, love on people. A lot of times God working through us changes lives.
Yeah.
And that there's nothing more gratifying than that.
Oh, yeah.
And when I am not encumbered with anything else except doing that, life is just wonderful.
Well, is there anything else worth doing? I mean, it makes everything else so easy when you bring people and love and God into your life, and it's easy to make a living doing that. I mean, it's just fun to show up to work, right?
Well,
and if you don't have to worry about the bathroom leaking or the ceiling leaking, all the better.
No, it's great. It's absolutely wonderful. And, the staff, both places that I work, these guys are good at getting good staff folks in there.
Yeah.
And, some folks who have left the practice, I'm still in contact with. We're still good friends. And when you're not their boss,
Yeah.
you can become better friends with some of your coworkers. So,
Yeah. Amen. Now, going back, you're in there, when I met you, I think it was '06 in Chicago. It was my first AID meeting. No, Truman, excuse me. They're all interchangeable, almost names. But Truman said, we're going to dinner. I walk into a steakhouse, and I think it was a Ditka's, and I think it might have been at the hotel there.
could have been.
And I swear, if everyone at that table wasn't 20 years older than you,
Yes.
and I felt like a babe. I felt like I was wearing a diaper at that table. But we had we had Crawford, we had Hilt there, Truman. We had all these greats.
Joe Littlejohn.
Yeah, maybe. But I just remember seeing you there, and I was like, oh, a younger guy. I'm going to sit next. How did you become the youngest old guy in the room?
Well,
I mean,
again, I snuck into Hilt's Continual. Well,
okay, that's right.
When you sneak into that,
yeah,
then Hilt says, the Alabama Implant Study Group.
Yeah.
Well, you go into there, and everybody there's been doing this for 25 years.
Mm-hmm.
Well, I've been doing it for 2 years.
Yeah.
And I'm just a sponge.
Right.
And it's like this meeting. One thing that's wonderful about the Alabama Implant Study Group, Jack Lemon's, in my opinion, the world's greatest implant researcher there's ever been, or just a dental products researcher ever around, from the University of Alabama. And where do you learn so much? A lot of times it's not in the classroom.
Mm-mm.
You're having dinner with a guy and you go, hey, do you mind if I ask you this? No. And it was just constant, different things. And I would ask all of these older guys, how do you do this and how do you do that? And here out would come the ink pens and napkins.
Yeah.
And they would draw,
Yeah.
and they would do this and do that. Walt Canals would draw things. And, a lot of our old colleagues like that, they're just, almost all the guys that I've mentioned are no longer with us.
Yeah.
But I keep saying I was the youngest old guy in implant dentistry at one point. Yeah.
Still are. Well, it's funny you say about the cocktail napkins, because Truman tells a story. He told me a story a long time ago, probably '06. And he said, Alabama Implant Study Group was the center of implant dentistry in the world, and people came from all over, and they came, and he talked about these Yanks coming down, and they'd all come down and learn in Alabama. And he said, we always were sitting there and drawing on the back of cocktail napkins late at night and smoking cigars and all this stuff. And he goes, and there was a gentleman in the back who was every time we were writing, he was writing. And he goes, it's the author of your textbooks right there sitting on the desk. It was Carl.
No.
He said Carl was coming down, and he says the way he says it. And that Yank ended up publishing a textbook with all of our ideas. Good for you, Carl, by the way. Yeah, God rest your soul.
Really. It's just, and Carl had a memory that was just amazing, because he could cite things. All of these guys could, but Hilt, Carl, and especially Jack Lemons.
Mm-hmm.
Jack would quote you something out of an article that had been published 20 years before, pretty much to the page.
Okay.
And it was I was just in awe of these guys and how they could remember all of this stuff.
Yeah.
And techniques that they had done. K.O. King, he was the guy who originated the free gingival graft out of Memphis. Did free gingival graft. Well, gosh, that was, and all of these guys are not specialists. None of them. They're all general dentists.
Right.
All of these techniques that have come up, sinus elevations, that was all Hilt. The gingival grafting like that was K.O. King. It's just amazing how the world revolved around general dentists that were willing to take risk step out of the box, look at it and go, in my brain, this will work. Let's see if it will work in real life.
Right.
And we will always be in debt to all of those guys.
It always seemed to be the case. The general dentists are the pioneers, and everyone's saying you're doing something wrong. You can't do X, Y, Z. And then when they see it works, they take it, and then they say you can't do it, right?
Yes.
You've seen that over 44 years.
Well, now this is, and speaking of pioneers, this year, the AAID Global Annual Session is going to be right outside my hometown in Nashville, Tennessee.
Right.
It is the 75th year of the American Academy of Implant Dentistry. I am on the task force that was doing the celebration for the 75th anniversary. We all met in Chicago at the AAID office, and we're going through old records and things like that. The AAID originally was called the American Academy for Implant Dentures.
Okay.
It was still the AAID, but it was implant dentures, not implant dentistry.
Interesting. I did not know that.
And Goldberg and his colleagues, when they first started out, went across the pond and watched Gustav Dahl do subperiosteals. Well, they came over and modified it slightly, got their technique down, and that's where it started. And it's amazing at all the different things that we would find as we would dig through there. We would find a photograph of the second meeting of the American Academy of Implant Dentures. And it's all of these folks back in the 50s, 40s and 50s. And it's just amazing. So I want to encourage everybody to come to the meeting in Nashville. We're going to have a 75th anniversary museum piece put together where we're going to have all of this old stuff.
That's cool.
And some of Goldberg's original art lectures. Now, back when they were lecturing, there wasn't any audio visual.
Right.
And all their notes, they were handwritten.
Yeah.
And if they had radiographs or anything, it was passed around the room. And while we were researching this, I found some of those, and I'm holding in my hand the original transcripts that were handwritten.
Man, we got to capture it. Did you get them captured electronically?
Yes.
Yeah.
And I'm holding some of his x-rays.
That's cool.
And, I'm sitting there and I'm just in awe.
Yeah.
Because this is where our profession started.
Yeah.
In implant dentistry. And it was just amazing. So hopefully we're going to put together this museum type area at the meeting. Our biggest dream would be to move that museum place from Nashville up here to Washington in the Smithsonian.
Yeah, that's where it belongs.
Well, it absolutely belongs there. And so, we can always dream.
Yeah.
And just like a lot of things in our profession, that's what it starts with, is a dream, isn't it?
Well, yeah, absolutely. You got to have the thought, and then you just got to put the passion into it and just start moving, man.
Exactly.
We'll get it done. We'll figure out. We'll get funding.
There you go.
Yeah.
75th
anniversary in Nashville. Are you speaking this year? Doing any presentations?
I am doing a presentation on, and this is something else that's very important. Credentialing. Okay. Myself and a couple of other folks are giving a lecture on how to pass the fellowship exam for the American Academy of Implant Dentistry.
Right.
Demystifying it is what we're saying.
Right.
And, just a process that you do, how to prepare for it, what you need to have in your back pocket during exams and things like that.
Yeah.
So, that's what I'm going to be lecturing on this time. Yeah. Are you presenting there too?
I'll be presenting. I'm doing my new concept on the Vitruvian arch I talked about this morning.
Yes.
Main podium Wednesday. I'm doing a dynamic XNAV workshop. And then I'm doing an hour for the teams. Talking
awesome.
to the auxiliaries.
Oh, beautiful, beautiful.
Yeah. About
Can't wait to hear all of that, man.
Yeah, hope you come, man.
Yeah. Okay.
I'm excited. I know it's a lot. I figured if I'm going, I'm just going to get all in.
Well, that's what you got to do.
Yeah, we're gonna make the most of it. Let's go there and talk and teach.
I can't tell you how many And speaking of staff members and the team thing,
Yeah.
I can't tell you how many times at these annual sessions I have presented to the team.
Yeah.
And a lot of times I'd really rather talk to the auxiliaries than the docs because they're new and fresh.
Yeah.
And 60% of the crowd that you'll be talking to there have been working in an implant office 6 months and they know nothing.
Right.
And it's just refreshing to teach newbies like that.
Yeah.
So it's a lot of fun.
It's funny you say that because my favorite class to teach in full arch is module 1. That's when the eyes are big and, you get all the beginners coming in and they're just so eager to learn. And then, the advanced stuff, sometimes you get people that come in that think they know it too much and everything and a little hard-headed,
Yes.
They don't let on that they don't know something. They come up to you after and they say, well, in the beginning, it's, I don't really need to be here. 2 days later, it's, oh my God, I learned so much. Right. But yeah, I love those newbies being out there.
Well, they don't know what they don't know.
No.
And they figure it out real quickly.
Yeah.
Yeah.
For everyone out there who's done just 20 arches, there's still a lot more to come. Okay. Yeah. And ask me how I know. I mean, I wish I could go back and redo my first 300 probably. I mean, if we're honest with ourselves.
Oh, well, again, when I started practicing, we had to think 3-dimensionally, working with 2-dimensional X-rays.
Yeah.
So when I got my first CAT scan machine, some of my older patients would come in, and I said, "Oh, I want to take a CAT scan of these root forms and blades that I did." And I stopped doing that because what in my head where they were wasn't actually the case.
Right.
And they were still functional and still doing well in spite of what I had done. So it's just amazing the techniques that we've got now married with the technology that we've got now.
Yeah.
How much faster we can complete treatment, how much simpler it is, and how much easier it is for the patients.
Oh yeah.
And that's the key right there.
Well, I talked about that accountability CBCT and X-ray.
Yeah.
Just checking your placement, learning, you thought it was perfect. How good was it? Where were you off? You guys didn't even have that back in the day. I mean, the learning progression must have just been more difficult, more tedious because you didn't get instant feedback. Do you feel like new practitioners are going to be able to accelerate and grow that much quicker?
Well, here's the thing that concerns me. Back in the day, we learned how to lay flaps.
Right.
Because we had to look at bone.
Right.
We weren't in real time.
Right.
We weren't able to look on a CAT scan and see bone.
Right.
The thing that concerns me now, and we were talking about using guides versus freehanding things.
Right.
Much like yourself, in our office, it's extremely rare that we use a guide.
Right.
Okay. There's some teaching institutions that when they're teaching implant dentistry, they're not teaching it from an anatomical standpoint.
Right.
Every surgery has to be done with a guide. And I've heard practitioners that have lectured before and said, I will not do a surgery without a guide. Well, when you're building a guide, aren't you building it from a CAT scan that you've made? Yeah. How accurate is the CAT scan? Because I can manipulate a CAT scan that's just been made and have 2 versions of it within moments. Which one do you trust to make your guide on? Okay. If you're anatomically trained, you know what you're doing.
Yeah.
And so that's what, can it be easier? Your question was, can it be easier for the younger folks? Yes, in the sense that it is a real confidence booster.
Yeah.
When you can verify it by looking at it on a CBCT. To me, at this stage of the game, I don't see how folks can do implant dentistry without cone beam.
Yeah.
So anyway, it's in some ways it's a lot easier. In some ways, I think they're handicapping themselves. They're handcuffing themselves by not learning how to do it anatomically.
Right. It can't be a cheat, So, I mean, do you like my theory that even though we're in this digital age and the throes of digital age, like your first lesson should be in analog full arch just so you understand it, right? Just, you think that there's value in that? I mean,
Well, there's no question. The concepts that we have are the same.
mhm,
Okay. But if you're manipulating it in an analog fashion,
yeah,
then it becomes real.
yeah,
Okay. And when you go to doing a digital protocol, if you have the knowledge of what I am doing digitally is a faster version of what I was doing from the analog standpoint,
right.
things to me get more accurate because you know what you're looking for.
Mhm,
Okay.
yeah,
And again, if you're taught with just digital protocol and nothing else,
mhm.
I think these folks may be a little bit handcuffed.
Yeah, I think it's a recipe for disaster. I mean, if things aren't going exactly perfect, what are you going to do? And when does everything go perfect? I mean, how often does it go perfect? Almost never. There's always a pivot. There's always a
Always,
roadblock, right?
always.
You got to be prepared for that.
Yeah, it just routinely. I can't think of very many times where something along the line you have to call an audible.
That's right.
You know,
That's what makes good surgeons and good dentists is being thinking dentists and thinking surgeons so that you can get your way out of trouble. Right?
exactly.
You can't just follow a cookbook every time and it's just going to work like a recipe.
Yeah.
Tell me about, I want to pivot because I want to talk about sports dentistry.
Oh, yeah.
Okay. I mean, like, tell us what you're doing, the organization. Let's give us a background because I know that you're big in this.
Well, I had a very unique situation at this meeting. They called me up and they said, "Hey, we know you're involved in sports dentistries. Would you be willing to come and lecture about it?" And I said, "Oh, if there's two things in our profession that I'm passionate about, implant dentistry
Yeah.
and sports dentistry."
Mm-hmm.
And the first question I asked when I got up to lecture, "How many of you are actively involved in sports dentistry?"
Mm-hmm.
And one guy raised his hand. Then I said, the next question, "How many of you even know what sports dentistry is?" and the same guy raised his hand. That was about it.
Yeah.
Generally speaking, we have in the United States on an annual basis 240 million people that are actively involved in something athletic,
Mm-hmm.
from little league baseball all the way up to seniors pickleball tournaments.
Sure.
Okay. With that comes injuries. There are over 5 million avulsed teeth in the United States every year.
Mm-hmm.
Now that's avulsed.
Wow.
That's the tooth is in my hand
Right.
out of the mouth,
Yeah.
not counting how many are fractured, not
Right.
counting how many are, dislodged.
Mm-hmm.
You've got all of these injuries that occur, especially avulsed teeth. That's where it dovetails into implant dentistry. And I was so thrilled and honored to be able to share with my colleagues about that because who better can treat an avulsed tooth and evaluate it to see whether it can be reimplanted.
Mm-hmm.
Most of the time it cannot because it's been too long since it's been out.
Right.
So what do? Well, you graft the site. Well, who better to do that than an implant dentist?
Right.
So I was very thrilled to have them here. I started, kind of my journey with implant dentistry started when I first started practicing. I wasn't married. And as married guys, when come the weekend or the day that you quit working, what do? Well, you go have an adult beverage, at one of the local places.
Mm-hmm.
Well, I'm sitting there talking to other guys who are sitting there like I was, and there were a couple muscle heads that were weightlifters. And they found out I'm a dentist, and one guy goes, "Hey, I need your help." Okay. He said, "When I'm deadlifting something, I clench my teeth and I keep breaking them." And of course, there at the bar, like he's going to do, he's showing me his cracked tooth.
Yeah.
"Can you make me a mold or something to protect my teeth?" And I said, "Well, the first thing we need to do let's get some crowns on these broken teeth that you've got, and then I can make you a mouth guard.
Yes.
And at the time, the only machine I had was the old 4x4 suck down, vacuum former like we all had. To make a long story short, different things happened very quickly. I was also sticking my toe in the water of TMD treatment. I was reading a lot of things about Harold Gelb, who was an old practitioner who was doing lots of research. He had something called a MORA appliance, mandibular orthodontic repositioning device. Okay. And it was kind of an overlay mandibular partial. And how he would recapture discs would be repositioning the mandible, and he would train muscles to accommodate this, and that would allow the disc to snap back into place. Now, to hold the condyle in this newly acquired position, you would either do full arch dentistry, where you would crown all the teeth, you would make an overlay partial, or you could do orthodontics and close the posterior bite that way. So I got to making these mouth guards, and I thought one thing that Gelb also reported on was improved athletic performance while people were wearing these MORA appliances. And I go, well, who wants to wear this hard acrylic thing? Why couldn't I incorporate that into a mouth guard? So I had some ideas, and I put together, and it was a horrible failure. Well, about that time, MTSU had an arm problem. I went to the orthopedic surgeon who happened to work with Middle Tennessee State's football team. And he said, I need your help. And I go, doing what? He goes, I can't find any dentist to work with athletes. Man, I'd love to. I'm an alum.
Why would they not want to work with that athletes?
There's no money in it.
Yeah. Okay.
Athletic dentistry, there is literally no money in it. You're doing it to help out young people. And to make a long story short, I've developed a what I call a MAM appliance. It's a mandibular advancing mouth guard. And the Academy for Sports Dentistry, one of the big things that they teach folks is how to make custom-made laminate mouth guards. Okay. Well, I put all these puzzle pieces together, and now I can take a George gauge, get a bite like I want to that anteriorly repositions the mandible.
Right.
And there's a lot of things that happen.
Yeah.
I've just finished the 11th year of a concussion study. I can't say that I've eliminated concussions, but out of the 11 years, we'll have a football team, MTSU's football team. They'll dress out, let's call it 100 players and change. Half of them I will make these custom mouth guards for. The other half doesn't want them.
Okay.
They want pacifiers because they're sexy.
Yeah.
Okay.
Right.
Yeah. So mine aren't sexy, but they're very functional.
Right.
Of the 11 years, there have been 5 years that guys wearing my mouth guards, none of them had concussions. The worst year we had were 3 concussions.
Okay.
Now, people not wearing mouth guards,
right,
or over-the-counter mouth guards are at least twice that every year.
Right. I believe it.
And it's just amazing. So that's one thing.
Yeah.
Now, whenever you also anteriorly reposition somebody, you open their airway.
Yeah.
So I've got another study where I have looked at one, you were talking about condylar positioning today.
Right.
When they're wearing this mouth guard, we're opening the condylar space on average. I did a study on opening the condylar space. Originally, it was 1.94 millimeters.
Okay. Yeah, it's healthy. Yeah.
3.64 is what it is when they're wearing these mouth guards.
Okay. So it's got to be more than the 2.
So ideally, all the research says anything over 3 millimeters, you're dramatically reducing the possibility of concussions.
It sounds like this is going to be statistically valid. I mean, it sounds like it's overwhelming. I'm going to add to that, to your statistics. I played a lot of contact sports. I mentioned at lunch I was playing hockey till just a few years ago. And I mean, I was full bore. And I'll tell you, when I hit somebody or got hit wearing my mouth guard, it did a lot less bell ringing up here.
Yes.
And a lot less, like, birds circling and stars moving. So add that to your research.
No,
And you can quote me on
I'll
that.
do it.
Put it in my paper. I felt better when I ran somebody down with a mouth guard than when I didn't. Yeah.
Well, there's over 500,000 in 2023. 562,000 athletes were playing NCAA ball.
Mm-hmm.
Okay. Across the United States annually, there is between 2 and 3.8 million concussions that are reported.
Mm-hmm.
That's reported.
Okay. Right.
Okay.
Yeah.
Now, when you've got little birdies
Mm-hmm.
or you've got stars in front of your eyes,
Yeah.
you've had a
It's
concussion.
not reported.
It's just not
Yeah.
reported.
Yeah.
And
So that
especially on the
number's
collegiate level, they don't want to report it
no.
because they want to be in the game,
Yeah.
get film so they can
Yeah.
do this on Sunday,
Yeah.
hopefully sometime.
Right. Yeah. They don't want to sit down.
Yeah.
So,
Yeah.
I mean, would you say it's 20 times underreported, 100 times underreported? I mean, it's probably a big number.
I would
Yeah.
say there's probably 10 or 11 million concussions a year annually. We had a young, and also we're finding now with a lot of older athletes,
Mm-hmm.
they're dying from CTE,
Mm-hmm. Yeah,
or they
we've
got
seen that.
Alzheimer's or Parkinson's or
Yeah.
something like that. Now the downside is, when do you know they've got CTE?
Mm-hmm.
When they're doing the autopsy.
Yeah.
Okay, and that's the only way that you can definitively diagnose this person had CTE is when you're doing an autopsy on them. But it is more and more and more where you're seeing Parkinson's and Alzheimer's on guys who played ball a long time ago when things were crude.
Yeah.
You know what I mean?
Yeah.
Yeah.
Well, I've lived quite a life in contact sports.
Yeah.
So I'm going to have to hope that they find a cure for this before. So you
I
guys
got
you guys out there listening out there, you better get my knowledge before I lose my marbles.
Well, and the Academy for Sports Dentistry, we are also the levels of who do we work with? A lot of them work with high school teams.
Yeah.
All the NHL teams
Mm-hmm.
dictate that a dentist be at every game.
Yeah.
So all of those team dentists belong to the Academy for Sports Dentistry. A lot of us are in the collegiate levels. I'd say most of us that are participating in the Academy for Sports Dentistry work with college level type activities, and it's just absolutely wonderful. You get to make friends.
Mm-hmm.
A gentleman that one of my players, Reed Blankenship.
Mm-hmm.
I'm showing my balance one arm flamingo test, and he is just blown away because I can't move him once he puts his mouth guard in.
Mm-hmm.
He's just absolutely flabbergasted. Well, he played for the Philadelphia Eagles for a while. He just recently was a starting safety for Houston now.
Mm-hmm.
And you get to meet these people.
Yeah. And,
we probably got a dozen people that play in the pro level now that I got to work with, and they're friends of mine.
Yeah.
So it's neat. And again, the Academy for Sports Dentistry is extremely similar to the Alabama Implant Study Group. Everybody is so warm and welcoming, and there's no egos because who are the people that we're serving?
Yeah.
We are serving people who actually can't do anything at all for us.
Mm-hmm.
Okay.
Yeah.
Because we don't get paid I donate all these mouth guards I make.
Right.
Don't get paid a dime.
Yeah.
And it's just because when these kids are my age, I don't want them to have Alzheimer's.
Yeah.
I don't want them to have Parkinson's. Whatever I can do to help them in that regard, that's why we're there.
Talk about giving back.
Well,
that's
there
absolutely
you go.
Amazing. Man, what haven't we covered that's near and dear to your heart?
I'm just grateful, and I'll give God all the glory for that because He has just provided me so many different things, and I always want to cover that. And I always want to give the credit to him for just providing all the opportunities for me, blessing me every day, keeping me healthy. I've had 5 different instances in my life where I should have died, and he's kept me around so I could talk with you this afternoon.
Yeah.
So I'm just very, very grateful.
Yeah.
I'm very, very grateful.
And
Grateful to have had this opportunity to share with you today. Very grateful I got to hear you lecture today. Every time I hear you speak, there is an improved concept or there is a brand new concept that comes out that is dead on, concise, and very applicable. So I want to thank you for that. Truman Baxter did very well by letting you come into his life.
Well, everything by the grace of God. I'm gonna say that too. Met Truman by the grace of God. Got into dentistry by the grace of God. These are longer stories. I don't want to take up all the time, but I absolutely mirror your sentiments on that for sure. We wouldn't be here. I think I can count at least 3 or 4 times I should have died. Maybe the next one's coming, knock on wood, but I always know who saved me and pulled me through.
There you go. There you are, brother.
Thanks for sharing this time with me.
Man, had a great time. Thank you so much for inviting me on.
You guys come see meet Walt in person in Nashville, September 30th at the AAID. Okay, you don't want to miss 75th anniversary reunion because, by the way, there's going to be a party downtown, and you don't want to miss that on Saturday night. That's
always, yeah. So
phenomenal.
please come to Nashville. We'll have a big time. You'll see a lot of folks who talk like me.
All right, we'll see you in Nashville, guys.
All right, take care.
Got to go all in. Don't forget it. All right, thanks, Walt.
See you.
Hey, if today's conversation resonated with you and you're looking to sharpen not just your technique, but your judgment, your discipline, and your long-term vision, then this is exactly why we built the Atlantic Implant Institute. This is not just some collection of disconnected modules. This is the core continuum for education and full arch workflow. It begins with Module 1, Core Bootcamp Fundamentals, where we establish surgical foundations, diagnostic discipline, and repeatable decision-making under real-world pressure. And then it continues with Module 2, Advanced Prosthetics and Full Digital Workflow, where occlusion, vertical dimension, aesthetics, condyles, and execution all converge. And then we have Module 3, which tackles remote anchorage, pterygoids, zygomatics, complex anatomy, taught through biomechanics, planning for predictable outcomes. And after the continuum, we have modules in FP1, fixed immediate load, and also business, how to 5, 10, 20. This is business, leadership, and operational strategy so that you can build surgically what actually works in practical business. If you're ready to go into full arch dentistry with intention, structure, accountability, and purpose, you can learn more at theatlanticImplantInstitute.com.